Laser en-bloc resection of solitary papillary tumors in the upper urinary tract. Description of the technique using a Thulium YAG-Laser. Transitional cell cancer is the fourth most frequent carcinoma. In 90 to 95% the bladder is affected. In only 5 to 10% the upper urinary tract is involved. Tumors of the renal pelvis are twice as often as of the ureter. In 17% there is an attendance of the bladder with the TCC of the upper urinary tract. In 22 to 47% there is a relapse of TCC in the bladder after TCC of the upper urinary tract. The relapse in the contralateral upper urinary tract is only reported in 2 to 6% of all cases. Invasive carcinomas are observed in 60% of all TCC of the upper urinary tract. In conformity with the EAU Guidelines for TCC of the upper urinary tract, the nephroureterectomy is still the gold standard treatment. But we get more patients with severe renal failure, patients with an anatomical or functional single kidney, patients with more comorbidities, and more patients have the desire for renal sparing surgery. In this video we present the en-bloc resection technique of a localized solitary papillary tumor in the upper urinary tract using a Thulium YAG-Laser. The 72-year-old female patient described an asymptomatic gross hematuria. The urine cytology showed suspicious cells with increased proliferation. In the retrograde pyelography we detected a suspicious contrast defect in the pyelo-ureteral junction. The patient had no history of urothelial cancer. Surgical technique: dissection of the tumor pedicle, coagulation of bleeding vessels, extraction of the tumor, cold cut biopsies, coagulation of the tumor ground, insertion of a double-J ureter catheter. This sequence shows the tumor before intervention. Dissection of the tumor pedicle. The tumor pedicle is circumferentially incised. The tumor is separated bluntly from the deeper layers with a ureter catheter. Remaining adhesions are divided with laser energy. As you can see, most of the tumor is already separated from the ground. It was difficult to reach the rear part of the tumor pedicle. For this purpose, a ureter catheter with a 10-degree higher flexure would be recommendable. Coagulation of bleeding vessels. Extraction of the tumor. The tumor was extracted with a 1.9 zero-tip nitinol basket. Cold cut biopsies from the tumor ground. Coagulation of the tumor ground. Finally, the tumor ground is coagulated with laser energy. Clinical results. The double J catheter was removed 14 days after discharge. The low-grade tumor was resected en bloc. The cold cut biopsy showed no residual tumor cells. Until now, no recurrence was observed for 1.5 years. The current kidney function is approximately normal. The en-bloc resection of solitary low-grade papillary tumors of the upper urinary tract using a Thulium YAG-Laser might be a feasible treatment option in the hands of experienced endourologists.